Do you frequently feel like your heart is racing or your body is always tired, even after a full night's sleep? What if I told you that these could be signs that your body isn't making enough healthy red blood cells? That's what happens in a disease called beta thalassemia. Imagine your red blood cells as tiny delivery trucks carrying oxygen to every part of your body. In beta thalassemia, these trucks are either broken or too few. So your body doesn't get enough oxygen, leading to tiredness, weakness, and other serious problems. It's not contagious, no need to worry about catching it from someone, but it's something people are born with. Let's dive into what really causes it. So, what causes beta thalassemia? Think of your body like a factory that builds proteins using blueprints from your genes. One protein called hemoglobin is super important because it helps carry oxygen in your blood. The beta part in beta thalassemia refers to one half of this hemoglobin. If your DNA has a spelling mistake in the beta globin gene, your body can't make enough of this part. It's like trying to build a car, but missing some essential screws. This mistake is passed down from parents. If both your mom and dad carry a faulty gene, even if they feel fine, you might inherit two broken copies and get the full disease. Would you believe that millions of people around the world carry this gene without even knowing it? How do you know if someone has beta thalassemia? Let's play detective. Have you ever seen a child who looks pale, gets tired easily, or has a swollen belly? These are big clues. Since the body isn't getting enough oxygen, the heart works harder, like a pump running non-stop, which can cause chest pain or fast heartbeat. Kids might grow slowly or have bone problems because the body tries to make more blood by expanding bone marrow. Imagine your skull bones getting thinner and looking different. This can happen in severe cases. Another clue, frequent infections. The body's resources are already stretched thin. If you see these signs, especially in families from the Mediterranean, Middle East, or Southeast Asia, it might be time to talk to a doctor. First, they check the blood. Simple blood tests can show if red blood cells are small and pale, like tiny weak balloons. Then they might do a hemoglobin electrophoresis test, which is like a hemoglobin fingerprint test to see which types are missing or abnormal. Genetic testing can confirm the exact DNA error. Now treatment depends on how bad it is. Mild cases, maybe no treatment, just regular checkups. But in severe cases, patients need blood transfusions every few weeks, like refilling the oxygen trucks regularly. But here's a catch. Too many transfusions bring extra iron, which can damage the heart and liver. So they also need chelation therapy, medicines that act like sponges to soak up extra iron. In some cases, a bone marrow transplant, the only cure so far, can give the body a new factory to make healthy blood cells. But it's risky and needs a perfect donor match. Can we stop beta thalassemia before it starts? Yes, through prevention. Think of it like checking the blueprint before building a house. If both parents are carriers, there's a 25% chance their child will have the severe form. Simple blood tests can show if you're a carrier, often with no symptoms. That's why in countries like Cyprus or Greece, couples are tested before marriage. If both are carriers, they can choose options like IVF with genetic testing to have a healthy baby. Spreading awareness is key. Did you know school programs in some countries teach teens about this? It's all about knowledge helping future parents make smart, informed choices. Exciting news, science is fighting back. Gene therapy is now a real hope. Imagine fixing the broken DNA in your body's blood making factory. In 2022, a treatment called Zynteglo was approved in some countries. It takes the patient's own cells, fixes the beta globin gene in the lab, and puts them back. It's like upgrading your software to remove bugs. Patients treated this way no longer needed blood transfusions. Also, CRISPR gene editing, famous for its precision, is being tested in trials. One patient, named Victoria, became the first in the US to be treated with CRISPR for this disease, and started living a normal life. These advances won't be cheap or available everywhere yet, but they're bringing real hope. Could this be the future of curing genetic diseases? Absolutely.